Function and appearance faster and safer because of many advancements in treatment. And joining us today is Dr. Hudson Seidel, an orthopedic surgeon at Connecticut Orthopedic Institute, to talk to us more about this wide-awake, local anesthetic, no tourniquet surgery. Doctor, welcome.
Thank you for having me.
Great to have you. So what can you tell us about this surgery?
So it was something that was developed about 20 years ago in Canada as a way to provide a more cost-effective and expedited access to surgical health care. And so what happens is about 20 to 30 minutes before the procedure, we would provide local numbing medicine to the area that also has some epinephrine in it. So you won't end up needing a tourniquet as well. It's pretty similar to having a procedure done at the dentist, essentially.
That's amazing. All right, tell us some of the benefits of this surgery.
So some of the benefits we see is a faster recovery. The patients are able to move their hands faster. We know in hand surgery, scarring can take place in as soon as 3 days. So it's really important to emphasize that. It's really beneficial that, you don't need any IV sedation or general anesthetic, so some of our higher risk patients. And then we have good evidence to suggest that patients are really satisfied with this procedure. So about 94% of patients say they would choose wall-on surgery again if given that opportunity. And then the biggest effect really is a cost effectiveness model. So, as we look at all the rising healthcare costs, the studies in the US at least show 80% reduction of cost in a trigger finger that's done in the office with wall-on versus in the surgical center with general anesthesia.
All right, doctor, who might be a candidate for this wall-on surgery?
Yeah, so I think it really depends on the procedure, but the spectrum is pretty much everyone in terms of it's really beneficial for our patients that are high risk for a general anesthetic, those with kidney issues and heart issues that really might have a higher risk with their procedure. We can have them be done under just the local anesthetic and avoid those risks. Another beneficial way is for people that, may have to work all day, right? So I know it's hard with everything in the world right now to find time. And so if you want to do it first thing in the morning, you can go to work right after your procedure, or you could come later in the afternoon and not have to be NPO or not eat all day as well, because you can eat.
All right, tell us how someone can proceed with getting this procedure.
Yeah, so the first step would be obviously to schedule a consultation with myself or one of the other fantastic hand surgeons around, and then kind of discuss your treatment options. Obviously, we want to exhaust all our non-surgical options first. We work with several members of the team, from hand therapists and other types of therapists as well, to get you back to what you want to do. But ultimately, if you're unable to manage your condition without surgery, then we talk about surgical intervention and this being a potential option for you.
All right, great explanation. Dr. Hudson Seidel with the Connecticut Orthopedic Institute. Thank you very much for joining us.
Thank you for having me.